Slit lamp biomicroscopy is a dynamic examination in which the eye is scanned anteroposteriorly and horizontally. Various ocular conditions can be identified by different methods of examination. These differ in the positioning of the illuminating light and the angle between the illumination and observation arms. Alvar Gullstrand, a professor of ophthalmology at the University of Uppsala in Sweden, he first presented his rudimentary model of the slit lamp on August 3, 1911. He also explained its optics and applications. There are three main parts of slit lamp. First is the observation system, second the illumination system, and the third the mechanical system. The observation system is a binocular, stereoscopic biomicroscope. This consists of a parallel Galilean telescope design. This magnifies the eye and the slit image. It is composed of two optical elements, an objective and an eyepiece. Slit lamp microscope produces an effective range of magnification with excellent resolution, which utilizes optical changes, interchangeable oculars, or both. Illumination system consists of light source, condenser lens system, slit diaphragm, opaque tube, illuminating lens, reflecting mirror, and color filters. Slit diaphragm consists of apertures and graticule. Apertures produce an area of 8, 5, 3, 2, 1 and 0.2 millimeters. Graticule consists of wedge-shaped diaphragm for continuous slit adjustment in millimeters. Filters have 5 settings. First is the open filter, which provides the brightest setting. Second is the grey filter, which is best for normal viewing since it does not reduce light intensity. The red-free filter is green and enhances the visibility of blood vessels, making them black. There is an empty filter which can accommodate an add filter. The last is the cobalt blue filter, which is used for examination of ocular surface after the application of fluorescent dye. The mechanical system consists of joystick arrangement and patient support arrangement. The joystick arrangement provides for movement of the microscope and illumination system towards or away from the eye or from side to side. The patient support arrangement consists of chin rest height adjustment screw, forehead band, and adjustable focusing target. Before we proceed with slit lamp examination, let us know the illuminations used here. The techniques of illumination used in slit lamp are broadly divided into direct and indirect forms. The direct illumination is any situation where the beam of light is directed to strike the principal subject area. Indirect illumination uses a secondary surface that reflects light onto the principal subject area, or the light is transmitted through the tissue from an area of adjacent illumination. Direct illumination are diffuse and focal illuminations. The focal illuminations are divided into broad beam, optical section, cone of light, and specular reflection. The indirect illuminations are proximal illumination, retroillumination, and sclerotic scatter. The retroillumination is again divided into iris retroillumination and fundus retroillumination. Before beginning the slit lamp examination, the patient has to be seated comfortably. His chin should be placed on the chin rest and the forehead should be attached to the forehead band. First of all, a diffuse light examination is performed. This facilitates simultaneous observation of large areas at low magnification. All the intraocular and extraocular structures can be quickly reviewed for gross abnormalities. Here, the slit illuminator is set at its largest aperture and the diffuser is put in place. The inspection in diffuse light often provides the first indication of abnormalities present in the cornea. Here, the angle between the slit lamp and the biomicroscope is 30 to 40 degrees. The slit width is wide open and the neutral density filter is used. broadbeam illumination, the term broadbeam is variably used. Here, the beam width can vary from a width of 1 mm to its full size of approximately 11 mm. Here, the beam is indented only as a source of bright focal illumination, and the width is adjusted to maximize the information within the area under study. Many conditions are best seen using broad beam illumination. The light should be applied tangentially for maximum effectiveness. In optical section, the slit beam is the narrowest, and a fine blade of light makes possible the virtual serial sectioning of transparent tissues in the living eye. Here, the light slices are presented tangentially, and this facilitates a cross-sectional view of the cornea and lens. The sharply focused light is completely confined to the optic section, thus reducing the scatter and maximizing contrast between the illuminated section and the dark, unilluminated surroundings. Thus, a clear, uncompromised view of the tissue within the beam is formed. Here, the slit beam is projected from an increasingly lateral position. The greater angular presentation has the effect of increasing the distance between the anterior and posterior surfaces of the structure under study. For maximum effectiveness, the light intensity is set to maximum, and the slit beam is diminished in width to a point just before the optic section loses structural integrity. The cone of light is based on Tyndall's phenomenon. Pinpoint illumination is maximally effective at isolating aqueous cells and flare. The anterior chamber is considered optically empty as its contents do not reflect sufficient light to express the beam in normal state. The cells and protein, if are present in response to local inflammation, can be readily seen when isolated within the well-defined narrow tunnel of light produced by pinpoint illumination. Here the size of the beam is 1 mm into 1 mm. The light source is directed 45 to 60 degree temporally and into the pupil. The illumination and magnification are the maximum. Specular reflections are subjected to Snell's law of optics. This law states that the angle of reflection equals the angle of incidence. This evaluation should be performed under a fairly low light level to diminish the scatter and make visible details within the zone of specular reflection. In specular reflection, the illuminating and viewing arms are so adjusted that each forms an angle of about 30 degrees to the central perpendicular. The angle between both the arms is 60 degrees. High magnification and illumination are used here. The sclerotic scatter is specifically applicable to the cornea. This permits the illumination of the entire cornea against a large unilluminated background. Here, intense beam of moderate size is directed at the corneoscleral junction. The light travels the breadth and width of the cornea by total internal reflection. In the normal cornea, this light passes through the stroma undisturbed and is visible only as a ring of light at the limbus where it intersects and is reflected by the sclera. The brightest portion of this ring of light is located directly opposite to the source. The normal cornea itself appears unilluminated. In the abnormal cornea, the light that is axially reflected or refracted makes the abnormality visible. The degree to which this light is visible depends on the optical density and other characteristics of the abnormality and the size and intensity of the incident light beam. In retroillumination, the light strikes the object of interest from a point behind the object and is then reflected back to the observer. In retroillumination from the iris, the observer is at right angle to the observed structure and not in line with light. So the pathology is seen against a dark, non-illuminated background. In iris retroillumination, the microscope is directed straight ahead. The light beam is directed to the iris at an angle of 45 degrees. This technique is most important for the thorough examination of the cornea. In fundus retroillumination, using the light reflected by the retinal pigment epithelium, the anterior vitreous, lens and cornea may be examined. The slit illuminator is placed into an axial position with the biomicroscope and the light is introduced through a dilated pupil to illuminate the fundus. With modest excursions of the illuminator to either side of the center, the optimum position is established and the greatest retroillumination effect is achieved. A large pupil is required for maximum effectiveness. After configuring a moderately sized beam, the entire instrument can be moved from side to side to facilitate examination of most of the cornea. In summary, stereoscopic appreciation of various layers of the eye is vitally important, and the slit lamp is a valuable tool for ophthalmic examination. A meticulous slit lamp examination is essential for every ophthalmic patient, and the examining physician must know the proper examination technique for proper diagnosis and management.